Okay, so let's continue on with our treatments for cystic fibrosis and talk about non-pharmacological therapy. I've put a little JPEG in here of a girl with her little vest on that vibrates and helps loosen things. That's part of chest physiotherapy or CPT. I will load a couple of videos that show about how to huff cough. Some of these will be patients talking about their experiences because I always find that those to be most helpful, and some basic information on cystic fibrosis. So, um, what they need to do is what's called airway clearance techniques or ACTs. Um, so one of those is coughing and specifically huff coughing. And what huff coughing does is it helps move the mucus from the into the small airways, and then when they cough again to move that mucus out into the larger airways where they can cough it up. Um, so what they do with huff coughing is they're going to take a deep breath in, they're going to hold it for 3 seconds, and then they actively exhale. Most of the videos show that they actually make an O sound, and they breathe out like they're fogging up a mirror. Give you an example of what that is. And what that does is as they take that deep breath in, it moves that air beyond the mucus, and as they breathe out, they are help pushing that mucus, and then they can cough it up out of their big airways. So they should have Kleenexes there and perform this several times in a row, several times during the day, and be sure that they are washing their hands after they've coughed to decrease the amount, to decrease any risk for infection. There's CPT, percussion, vibration. With deep breathing, we do postural drainage. So you want to put their head down so that as we do the CPT, so there's a couple of ways to do it. You can actually do it with your hands and your hands cupped. I literally remember learning this in nursing school because we didn't have vests and things like this, and you just kind of use those cupped hands and go down. Pounding's not the right word because you don't do it that hard, but you do hit their chest. That does that CPT. I will tell you, I would always do this with my vent patients when we turned them at night because I worked in the ICU. See if we could get, a little mobility of secretions going because it was a technique that I learned, but certainly do it for your kids. The important thing of CPT is this needs to be done before they have a meal or an hour and a half after they have meals. And it's done between 1 to 4 times a day. Duration is usually somewhere between 20 and 40 minutes. So if they can use the vest, certainly those vests can run and vibrate, and they certainly will have a sound as they talk. With this, I think it's important to think of that if we've got kids doing this for this amount of time, what can we do to keep them entertained while they're doing that? Maybe allow them to do something fun, maybe have some screen time. They get it just when they do CPT, or they get to play a game that they like, or, read, have somebody read them a book, whatever it is, to keep them going during this CPT. But it's important that they do the CPT before they eat, so that we don't have any issues with it affecting the GI. They also may have a real need to go to what's called pulmonary rehab. And it is specifically targeted for patients with pulmonary problems, patients with asthma, COPD, cystic fibrosis can also all go to pulmonary rehab, but it's a multidisciplinary approach, and it's there to improve their quality of life. It does focus on breathing exercises, exercise training, nutrition. This rehab is also good because you're there with a group of people, so you realize that you're not alone, and you can get some real benefit from seeing other people and really just kind of having some camaraderie as you talk to other people who are having and dealing with cystic fibrosis the way you are. Okay, so we got some lifestyle choices. That is the term that your book uses that's important. One of which is diet, because this affects the GI tract and they have nutritional deficit. Having a healthy, well balanced diet is important. These guys are going to need high calories, high protein, high fat. Um, They may need to be sure to increase salt during summer and intense exercise so that they don't have hyponatremia. So, when we think about cystic fibrosis, that certainly is the concept of gas exchange. But what other interrelated concepts are these? We have nutrition, fluid and electrolyte. We can have mobility, or what I would call activity intolerance. Certainly psychosocial, those are the ones that are just coming to the top of my head. Um, we need to make sure that they stay well hydrated because that will help move some mucus around. They do need to have regular exercise and fitness related activities. That is okay. They're just going to have to kind of figure out how to do that and work with their cystic fibrosis to make that happen. Um, and to be able to do as much as they can. Certainly, absolutely no smoking for these patients. They have such significant respiratory problems because of the buildup of mucus that smoking is just absolutely shouldn't do that. And they actually should avoid secondhand smoke, which may mean that we have to have discussions about smoking cessation with parents, grandparents, family members, loved ones, and those types of things. They certainly need good hand hygiene and to practice infection prevention. They do need to stay 3 feet away with anyone else with cystic fibrosis so that they don't risk spreading infections to other patients with cystic fibrosis or getting those from other people. And that's difficult when it would be nice to hang out with other people with cystic fibrosis. Um, it's very imperative that they stay up to date with their vaccinations and certainly a yearly flu vaccine. They certainly don't need flu and they don't need any other kind of infection that can be covered or illness that's covered by vaccine, especially anything that might affect respiratory status. And the one that comes to mind for me is actually things like whooping cough. They need emotional support and counseling. That could be the parents, that could certainly be even a school age child, teenage people in adolescence, teenage years, because they are moving from being a child to be taking more responsibility for their own care and what adulthood looks like, and they certainly want to have their own values and make their own decisions in their life, and they may need some counseling. I think the anxiety, stress, depression, coping, caregiver role strain is important, as well as we had to just kind of pick some problems for these people. Okay, so let's talk about our lifespan considerations. Um, So, for infants and children, genetic counseling might be appropriate for people, especially if they have the parents have a family member who has cystic fibrosis, to know whether they carry the gene. Um, this might be that if I know that I am a carrier of the gene, that I have my partner get tested as well to know if we have a risk of having a child with cystic fibrosis, and get some genetic counseling to know what that means, what that risk really is, and whether or not we want to actually have children. Um, Infants could have a meconium ileus, and have vomiting and abdominal pain, so that could be seen. That may be one of the first tests. They will have failure to thrive, and certainly that skin tasting salty. So the book speaks more about adolescents, which I think is quite appropriate. They do have an elevated risk of osteoporosis, osteopenia, broken bones. They do need to do weight-bearing exercise and take supplements as needed. We've already talked about that. Because of the cystic fibrosis, they may have a delayed onset of puberty. So that would be important to know that if they are not developing like their friends, they haven't, if it's a female, they haven't started their period, they're not developing breast tissue, that's going to come later. If they're a male, that their voice hasn't deepened, they're not developing facial hair, armpit hair, all those kinds of things. There's lots of other things with growth and development that they're just going to be delayed in that, and that is normal for them. Probably the biggest thing that I think we need to really think about, nurses, and how to do this, deal with, is this greater independence and self-care that somebody who's in adolescence should be taking on. So that's two-part is, as the patient with cystic fibrosis is getting older, they need to be more independent and be more responsible for their own care. That also means that parents need to allow them to do that. So parents need to kind of back off and let them do that. So we've got to deal with both the adolescents and their parents as they are getting older and can take on more responsibilities. They need adequate nutrition, they need sleep, they do need to figure out how to manage their daily medication regimes. They need to be more involved in their own healthcare decisions because this is their body. Certainly once they turn 18, they're considered an adult and they can make those decisions. But if we're dealing with people who are 14, 15, 16, 17 years old, they need to be involved in that. And they may need social, emotional, and social support as well, because their life is not like that life of their friends. And that's kind of hard because it's just hard being a teenager. So adults, life expectancy, like I said, is now between 20 and 30. Advancements have really reduced the need for lung transplants. Your book does have a little note about women, pregnant women. So those with good lung function are less likely to experience preterm delivery, than thus having higher birth weight babies and not preterm infants. They do have a much higher risk of gestational diabetes because of their the pancreatic issues with cystic fibrosis. So any woman who has cystic fibrosis who is thinking about families really certainly need to sit down and have a conversation with their pulmonologist and their OB/GYN to see if this is what's pregnancy going to look like for them, so that they can remain healthy and that their baby can be healthy. Okay, so let's just do a little summary for you guys. I think that's kind of helpful. It's helpful for me to kind of get it back in. So this is an autosomal recessive gene that affects mucus production. The most common places are in your lungs, where they get that really thick, sticky mucus in their lungs. It affects their pancreas, can affect their liver, can affect their GI system. Certainly their skin's affected. They have too much salt, and we have reproductive organs, decreased fertility. They can have some increased pregnancy-related complications. So it's very important that we work on. This is really an overall health problem that we have to look at from many different directions. It's kind of multidimensional. It's not just, well, you have this and here's your meds. They do have to take their medications. They're going to have a long list of medications. So they're going to take antibiotics when they have an infection. They're going to need to take anti-inflammatory to help decrease the inflammation. They're going to be on bronchodilators, which is important that they take those before their chest physiotherapy. They're going to be on mucolytics like acetylcysteine to help break up that mucus. They might be on the CFTR modulators, which have to be taken with fatty foods. They absolutely will need pancreatic enzyme supplements that they're going to take before all meals and snacks, and take those with foods that contain fat. They're going to need to take fat soluble vitamins A, D, E, and K. They're going to need minerals like calcium, iron, zinc, and sodium. They're going to need to do airway clearance techniques, so huff coughing, CPT, whether we're doing it manually using a vest, and need things like pulmonary rehab. So as you study this, be sure that you're going through the nursing process. What health history questions do you have? What's you going to look at for physical exam, which certainly will be respiratory, GI. You're going to have to ask questions like, what do your stools look like? Because that greasy, foul-smelling stool is very common for them. Do they have constipation? Do they have diarrhea? What we're going to need to analyze their lab work. We're going to need to be concerned that whether their blood sugar's like, because they can develop diabetes. What are your goals for these patients going to be? This is really adequate oxygenation, gas exchange, adequate airway clearance, adequate nutrition, appropriate coping. I think those are the most important ones. And then what are we going to do? We really have to think about teaching for these patients and their families, all the things that we need to teach. What resources do we need for them? Psychological problems with them as well, with stress and anxiety and depression, and maybe grieving. Your teenager could be having what's fundamentally grieving because they're not like everybody else. The parents could have that because they've got a baby who's not like everybody else's baby, and I have to do all of this care. So please think of those as you're going through these, and think of how you're going to take care of a patient with cystic fibrosis that's going to span from infancy into adulthood. Thanks.